it's Jenny B, NSWOC. Today I'm actually going to be doing an update on our current CVAD or PICC line protocol dressings as they've updated in the past couple years. So the Canadian Vascular Access Association has provided some different guidelines on how we're actually cleansing the dressing. We've also had some great benefit when we've switched over now to the use of a Tegaderm IV Advanced chlorhexidine impregnated dressing. So we have been recently putting lines in our facility. Gotta love little small places that can do big things. And with that, we've really kind of dived into what are the best practices for this. So again, we've switched up because still in our area we're using IV dressings that look somewhat like this for our PICC lines, but they do offer some great protection, but we're trying to update to the new Tegaderm IV CHG Advanced. So as you'll see with this, it has a lovely little square in the middle. The CHG stands for chlorhexidine gluconate, so it's actually impregnated with that, and it continuously bathes the end of the catheter in the chlorhexidine, so it actually will reduce our CLABC infections. So for the most part, after our PICC lines are being inserted, we're still doing a dressing change the day after, just in case there's any bleeding or whatnot at the site, and we're switching over to these dressings. So I want to talk a bit today about some of the features of the dressings that you may not even know that are there. I was actually quite surprised when I first learned about some of them too, and talking about some of the cleansing techniques, because it's definitely an update from previous video that I've done. So for the most part, when we're going to see a PICC line or a IGA, it could be subclavian, the line's going to look similar to this. And when you go to change your dressing, this is, there's some techniques I want to show you. So number one, you're always going to have your little date and time on there. And so for the most part, we can just take that piece off. Well, then the new dressings are actually perforated at the bottom, so we're not actually having to try to pick and pull this off. So we actually, the perforations will allow you to remove the dressing a lot easier. So the perforation goes right up into the edge, and so it'll come right up to the actual opening. And then when you're going to pull back, we're going to just try to very slowly, so we're not doing any tearing of the patient's skin. So it's almost in this 180 direction where we're going to be pulling it off the skin. You're not going to round the patient up and down, but you will do this. So then we're going to pull this dressing off just like this. Now again, you're going to be doing that with clean gloves for the most part, and often these lines will actually have an anchor on, so I'm not so worried about the line falling out because there is a securement device. I did show you how we would actually change the securement device in previous videos, but I am a little more focused on the actual dressing with this, as well as the cleansing. So we're still going to be using our swabs to cleanse. So for the most part, we can still stick with the actual alcohol-based chlorhexidine swabs. The alcohol is going to actually allow it to dry a little bit faster. I know previously we'd used in the Boston Scientific catheters, and there was concern about erosion with the alcohol, but for the most part we're still asking that we still use these because the alcohol is going to allow the skin to dry a little bit faster, and they're not as concerned with there actually being any erosion from the catheter. So again, you're still going to do this in a sterile technique, which the sterile technique would be the same, but then the changes really are that with the swabs, when you're actually cleansing, instead of going in a circular motion, we're actually going to be doing it back and forth. So when you get to this point in your sterile dressing change, yes, you can still kind of hook and clean underneath, but what we're going to do is actually back and forth. I can't see very well this way. We're going to do it back and forth on the bottom, and then you're going to flip your swab and do it back and forth on the top, all the way up and away from the actual catheter. Then you're going to do it back and forth away from the catheter on the sides, and back and forth away from it on the opposite side, and again flipping your swab for each section that you're doing. It's actually the friction that's going to provide the cleansing more so than the chlorhexidine alone. And the big piece with this is that we do need to allow it to dry. I still find that people sometimes have, they call it, they've had a skin reaction to it, then they end up putting on a silicone foam, and then to try to protect the skin. But the big reason often why people are having that skin reaction is because they didn't allow it to dry. So we don't want to blow on it, we don't want to wave at it, we just want to allow it that full 30 seconds. And I know it's a long time in a nurse's life to wait that long, but when you're no longer seeing any glistening really on the skin, that's a good indication of when it's fully dry. So again, it has the nice part about the Tegaderm CHG. So everyone has a new little packaging. It's pretty much the same footprint as the old one. So this is what the old one looks like, and then here's our new one. So that stuff is not much different. It continues to have on the one side the actual time and date sticker, and then the other is part of the actual anchoring and securement. So this is a little bit wider than you'll note with the other. So after it's fully dried, you're going to again remove your backing, and we, like as Snoop Dogg says, we want to drop it like it's hot. We don't want to actually push or pull on this dressing, because again, that's the part that can actually cause some skin damage. If there's any tension on it, as with any tape, when you pull and you stretch this, then it recoils back. That's what that tension on the skin is actually can cause blistering as well around the edges. So when you go to put it on the patient, because often their arm is like this, we're really just going to drop it down. So we're going to drop it on. Yeah, we're going to drop it like it's hot right on top. It's a little harder this way. So usually you're going to be using two hands. You're just going to drop it. And by dropping it, as I said, you're not applying any tension. So as long as you've relatively gotten the catheter in the middle of the square, that's really what we're looking for, because what we want to do is bathe that open area, or where the insertion site is, in the chlorhexidine for those 7 days to really help reduce our CLABSIs. Once they're down, then we can, again, just gently put some pressure on the rest of the tape and make sure your lines are coming out through the hole. Then the backing comes off around our dressing, and then we take the larger piece, so we'll time and date it after, because we're all a little crazy about that stuff. And then on the back of this piece, there's actually little tabs to be able to remove the tape. So the tabs, you can see my hand sticking there, that's what you're going to be able to hold it with, just help keep it unstuck from your gloves. Then you can lift up, and then this little hole will line up underneath, and that's how you're going to actually get a good seal. And again, we're just going to place this on. We don't want to apply much tension. So then once you take the little paper backing off, you can flatten it down, and we're good. I usually end up again putting my time and date, and I will put it right across here, so that gives it another really great seal. So again, that's just really to update on previous PICC line dressing video, because again, we really want to be cleansing it all the way out, both sides, up and down. Again, if you were to put a securement device underneath there, if you actually attach it to the catheter and snap it before you actually stick it down to the skin, we also want to make sure that that skin is dry prior to putting it on. Thank you so much for watching my update, and we'll see you in the next video.